हेलो गुड मॉर्निंग, मैं से डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के पास्ट ईयर क्वेश्चन पेपर। विच ऑफ द फॉलोइंग इज ए कैरेक्टरिस्टिक फीचर ऑफ कॉलमैन सिंड्रोम, इंसोम्निया, syndactyl in males, precocious pivot in female, and white fall leg? Here the answer is insomnia, because the Kallmann syndrome results from the defective hypothalamic gonadotropin releasing hormone synthesis and is associated with insomnia or hyposomnia due to the olfactory bulb agenesis or hypoplasia. Next question: which benzodiazepine is suitable for the safe administration to a 40-year-old chronic alcoholic experiencing withdrawal syndrome based on the liver function test that indicated AST level of 140, ELT level 110, and GGT levels of 500? Diazepam, alprazolam, clonazepam, and lorazepam. Here the lorazepam is the answer, because the lorazepam is not extensively metabolized by the liver and its clearance is less affected by liver dysfunction compared to other benzodiazepines. It has a shorter half-life than diazepam, making it a suitable option for managing alcohol withdrawal symptoms. In patients with liver disease, lorazepam is commonly practiced for this purpose. And next question: all of the following add in the localization of the lesion to the spinal cord except contralateral hemiplegia is the answer, because the contralateral hemiplegia refers to weakness or paralysis affecting one side of the body is that is opposite to the side of the lesion. However, contralateral hemiplegia is not a characteristic sub-lesion within the spinal cord. It is more commonly associated with the brainstem lesion. Next question: which of the following is not characteristics of bone cord syndrome? Complete transaction of the spinal cord. Here the answer: not complete, because the complete transaction of the spinal cord is not a feature of Brown cord syndrome. Brown cord syndrome is a specific pattern of spinal cord injury characteristics by hemisection of the spinal cord. One half of the spinal cord is damaged or reverse presentation ipsilateral, proprioception loss, and spastic weakness due to corticospinal tract involvement, development of radicular pain at the level of lesion. At level of lesion, muscles fascicular areflexia, contralateral pain, and temperature loss 2 segment below. Next question: a patient with heart disease has breathlessness on going to the bathroom. What grade does he belong to? According to the NYHA functional classification, assess the impact of heart disease on a patient's daily activities. NYHA 3 indicate the answer. Indicates moderate symptoms. Patient classified as NYHA 3. NYHA 3 experience symptoms such as the marked limitation of physical activity, becomes symptomatic with less than ordinary activities such as going to bathroom and having no symptoms at rest. Next question: an increased anion gap is seen in metabolic acidosis. Increased anion gap is seen in metabolic acidosis because the metabolic acidosis occurs when there is excess of acid or loss of bicarbonate in the body, leading to a decrease in the bicarbonate concentration and a decrease in pH. This decrease is compensated by an increase in chloride ions, resulting in an increased anion gap. Next question: based on the ECG given below, which of the following is not used in the management of this condition? Verapamil, metoprolol, amiodarone, non-synchronized DC shock. Here the ECG. Here the ECG is suggestive of the atrial C-lead 2 fibrillation as the region irregular rhythm and absent P wave absent here with narrow QRS and QRS complex are present in atrial fibrillation. Synchronized DC cardioversion or cardioversion can be used. Non-synchronized DC shock defibrillation is not used in the management of this patient. The only indication for defibrillation are unsynchronized cardioversion are pulseless ventricular tachycardia and ventricular fibrillation. Here the in ECG such to atrial fibrillation, where the irregular rhythm and absent P wave and narrow QRS complex. So the here answer is non-synchronized DC cardioversion. That's all. Thank you and keep revising.